Alright, I want to spell out for the utter fools on Twitter crying about more than 200,000 Americans are dead because of the Rona, that the official death toll is a blatant lie. First, I need to stress that COVID-19 is a novel coronavirus. That means it's new. That means it wasn't causing deaths before 2020, which strongly implies that deaths it does cause would also cause there to be more deaths in 2020 than in years without this new coronavirus. Second, all the numbers and graphs in this video come straight out of the CDC, those experts we're all supposed to shut up and listen to. Now, what you're looking at here is a table of all the conditions contributing to deaths involving COVID-19 in America by age group. Link in description. The age group breakdown isn't terribly important for this, just the total numbers. But first, notice the note 2 on total COVID-19 deaths item. At the bottom of the table, we can see that this note is, quote, deaths with confirmed or presumed COVID-19, coded to whatever the code is. That word presumed is very important. It means that doctors can assign the Rona to any deceased who had symptoms of the Rona without so much as a positive test, which was explicitly and publicly stated back in early April to be the case, seen in this guidance from the CDC here, linked to the PDF in description. It says, quote, in cases where a definite diagnosis of COVID-19 cannot be made, but it is suspected to be likely, e.g. the circumstances are compelling within a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. Here is a list of Rona symptoms from the CDC, link in description. As you can see, there are symptoms like cough, fever, sore throat, runny nose. These could be caused by damn near anything, including half a dozen different flu strains. You could have seasonal allergies, die from renal failure, and they could assume you had the Rona and add it to your death certificate. Keep that in mind moving forward. Now see this graph off the CDC website, link to the little graph tool in description, showing weekly deaths by select causes, with 2020 deaths in red and deaths in earlier years in gray. Look at the respiratory deaths here, where there is a very small bump in deaths around early April, which returns right to normal by week 20, aka the month of May. Firstly, this right here shows that there is currently no pandemic of recording this on like November 8th or 9th. There hasn't been anything resembling a pandemic due to a respiratory virus like coronavirus since April. Secondly, back at the table of contributing conditions, we see that the CDC includes nearly 95,000 deaths from influenza and pneumonia in the Rona death toll. Now, it's entirely reasonable to say that the Rona could cause pneumonia that killed someone, and then chalk that up to the Rona. But if this new coronavirus was really responsible for causing more than 90,000 pneumonia and influenza deaths, why doesn't the graph reflect that? The graph says we have about the same level of respiratory death as normal for the past few years, and actually markedly less respiratory death than in 2018. The obvious answer is that 2020 has the same respiratory deaths to any number of causes, including contagious illness, but they just called every one of them a death to the new scary virus. You can see they did the same thing with malignant neoplasms. Malignant neoplasms are cancer for the layman. You can see on the graph that cancer deaths are exactly the level they've been every recent year. Yet the CDC includes more than 10,000 cancer deaths in the death toll of this new virus. Once again, if this hot new virus caused 10,000 cancer deaths in 2020, wouldn't that mean 2020 cancer deaths would be slightly higher than in previous years without a hot new virus to cause them? Once again, they took the deaths that we get every year and just called them COVID to inflate the numbers. Remember, they don't even need a positive test. Fatigue or muscle aches are Rona symptoms and are also likely to be seen in advanced cancer patients for any number of reasons, so they can just say it was the Rona based on these vague symptoms. Now, up till now, I've been ignoring the massive spike in circulatory disease deaths shown on the graph. Could they be a result of the Rona, and therefore mean I am wrong and stupid? Well, probably not. For one thing, I doubt a respiratory disease is likely to have caused nearly 25,000 deaths from ischemic heart disease. That's just silly. Furthermore, and much more importantly, those of you with longer memories than politicians would appreciate you having might recall that America shut down a majority of all hospital function in preparation for a Spanish flu-level pandemic that never came. This occurred in late March, early April, depending on exactly which state you lived in, but all right about at the base of that big spike in circulatory deaths. Let me ask you this. What seems more likely to you? That some spicy new respiratory disease caused tens of thousands of excess death to circulatory disease? Or that shutting down hospital functions like diagnosing and treating circulatory disease for a good 2 months caused tens of thousands of excess deaths to circulatory disease? I should think the answer is obvious. The response to the Rona, particularly shutting down hospitals, caused more excess circulatory deaths than the Rona itself possibly could have. Before I wrap this up, let me show you my favorite item in that table from earlier. Intentional and unintentional injury, poisoning, and other adverse events. 7,700 deaths. It's like this man was shot in the back of the head twice. Clearly, he died of the coronavirus. It's an absolute sad joke. I don't have any clue what the actual death toll from the Rona is. That's not the point. The point is merely that the 220,000 or so number that puppets on Twitter float about is an obvious and blatant lie, and I think I've proven that beyond any reasonable doubt. If you agree, share this video with every fool you see citing the official death toll. If you disagree, lay out your criticism or counter-argument in the comments, and have a good rest of your day.